So treating the worst asterisk sign has usually helped me. And regardless where it is in the body. This took some time for me to practice and for me to get on top of. This is probably one of the basics in the new clinical reasoning process, the Ridgway method. Once again, Michael Ridgway and his institute are excellent at teaching this. I would highly recommend you have a look at this. If you're very serious about musculoskeletal health, if you're serious about learning to be the best at musculoskeletal health and to treat anyone in musculoskeletal health, looking at Michael's website and even contact him. Say that you spoke to me or you saw this video and because of this you're contacting him. He's a wonderful gentleman. He will be overjoyed to help you out. And so will his team. Wonderful team, by the way. Now, what is this called? If you are doing a treatment and you're doing a functional test together, it's called a treatment directional test. If you get to see a few of my videos in the future, and if we ever cross paths and you get to come to one of my seminars in the future, or if I'm doing a keynote speech somewhere and you hear of this concept, or if you get to see me and you're in the audience and we get to cross paths during that time, you might hear me talking about TDTs. TDTs are treatment directional tests. So a typical treatment, typical TDT is that I've treated the person's lumbar, the glutes, for example, in a couple of slides ago as I was talking about. Treating the glute, and the functional test is lumbar flexion. TDT. This stuff is also on the Ridgway Method website, and I'd highly recommend you go and see that too. And as I said before, if you are doing this, you will find that it allows you to know that you're on track. It shows the patient that you're on track as well. And my goodness, that is so vital, because instead of at day one, you treat an area that you found was quite helpful, but it wasn't the best. The person goes home, they come back, reassess. You may have lost up to 2 to 3 days by the time this person comes back. You may have lost, best possible scenario is 1 day. They come in the next day. But imagine you do the testing and you work out that the worst possible structure you've been able to treat, and they've gotten a bigger result, not a smaller result, they get a bigger result, and the improvement is such that the healing time has gone from there to there. So it's very helpful. So that's something I'd highly recommend. The TDTs shows your clients, shows your athletes, shows your patients you're on track, and that is very helpful.